my name is Ashley Hamilton, and today I'm discussing type 1 diabetes mellitus. In order to understand type 1 diabetes, you first have to understand the role of insulin in your body. Whenever you eat carbohydrates, your body turns them into a sugar called glucose. Insulin acts as a key that allows the glucose into your cells. Your pancreas produces insulin to allow this to happen. In a person with type 1 diabetes mellitus, your immune system sees the insulin-producing cells, islets, as foreign and attacks them. This is known as an autoimmune disease. Type 1 diabetics treat this by taking insulin injections. This can be in the form of a syringe and a vial, an insulin pen where you press a button, or an insulin pump, which allows you to tell it what your blood glucose is and how many carbs you're eating, and it automatically injects the amount of insulin you need through a tube into your body. If you take too much insulin, your blood sugar will drop. This is known as hypoglycemia. Hypoglycemia effects include shaking, dizziness, sweating, and if left untreated for more than a few hours, could lead to death. If you take too little insulin or eat too many carbs, this leads to hyperglycemia, an excess of blood glucose in your bloodstream. The effects of this include extreme thirst, excessive urination, and mood changes, like easily being angered. The long-term effects of hyperglycemia include kidney damage, liver damage, damage to your eyes, and pretty much all of your organs. It can even lead to cell death in your extremities. Now I want to discuss some recent advances in searches for better treatment options and a cure. Both of the options I'm going to discuss are still in the research stage, so they're not available to the public. The first option is islet cell transplants. Remember that islets are the insulin-producing cells on your pancreas. So a surgeon would take islets from an organ donor and transplant them onto the pancreas of a person with type 1 diabetes. The second option is an artificial pancreas, which is similar to the pump in that it provides you with insulin without you having to tell it how much insulin, but it also monitors your blood glucose levels, so whenever you would eat, it would automatically know how much blood glucose it needs to adjust for. So I would no longer have to tell it how many carbs I'm eating or what my blood glucose levels are. Some researchers are taking it a step further and adding glucose to the artificial pancreas. So when my blood glucose dropped too low, it would automatically give me some glucagon. Thanks for listening. I hope you now have a better understanding of type 1 diabetes mellitus.